Hello everyone, welcome to Yellow Pages Nursing. In today's video, we will be discussing about barrier nursing, reverse barrier nursing. Before entering into the session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notifications. Let's get into the topic. So what are we going to discuss in this video? The learning objectives are: what is barrier nursing? What is reverse barrier nursing? What are the key components of barrier nursing? And what are the key components of reverse barrier nursing? Let's move into the topic. Barrier nursing is also called source isolation, where the patient is the source of infection. Barrier nursing is a set of infection control practices used to prevent the spread of infectious agents between the patients or from patients to healthcare providers. Barrier nursing is commonly used when caring for patients with known or suspected infectious diseases that can be transmitted through direct contact, droplets, or airborne routes. The key components of barrier nursing are hand hygiene, personal protective equipments, patient placement, environmental cleaning, traffic control, using of separate equipments. Let's look at it one by one. Hand hygiene. Wash hands with soap and water or using alcohol-based sanitizers before and after patient contact, or follow the 5 golden moments of hand washing. Main thing is we need to follow the steps of hand washing. Next is personal protective equipments. Wear appropriate PPE such as gloves, masks, gowns, and eye protection to create a barrier between themselves and the patient's infectious material. Follow appropriate donning and doffing techniques. Next is patient placement. Patients with contagious infections like TB, chickenpox, conjunctivitis, COVID-19, etc. are placed in a separate room or area to limit the spread of infections to other patients. Example, negative pressure rooms help prevent the spread of tuberculosis by containing infectious aerosols within the room and preventing them from escaping into other areas. Next is environmental cleaning. Regularly clean the surface areas by using appropriate disinfectants or chemicals as per the institutional policy. Areas include patient room, paying special attention to clean the high-touch surfaces and equipments in the patient's environment. Next is traffic control. For healthcare workers, if there is a need, visit the patient's room after wearing PPE and maintain limited access to the patient's room. Visitors may be restricted, or if required, visitors are supposed to wear PPE and perform hand hygiene before entering the room. Next is use separate equipments in order to prevent cross-infection. Now comes reverse barrier nursing. Reverse barrier nursing is also called protective isolation, where the patients require protection from the infectious agent. Reverse barrier nursing is a set of infection control practices used to prevent transmission of infectious agents from healthcare workers, visitors, or the environment to the immunocompromised patient. Who is an immunocompromised patient? An immunocompromised patient refers to a patient whose immune system is weakened or impaired, resulting in reduced ability to fight off infections and diseases. Examples include organ transplant recipients, HIV or AIDS patients, cancer, etc. Now, key components of reverse barrier nursing include hand hygiene, personal protective equipments, patient placement, environmental cleaning, traffic control, use of separate equipments. Let's look at this one by one. Hand hygiene. Hands are washed with soap and water when it is visibly soiled or Alcohol-based hand sanitizers are used and the 5 golden moments of hand hygiene is followed. Next is personal protective equipments. Everyone entering the patient's room, like the healthcare workers, relatives, and others, should strictly adhere to strict personal protective equipment requirements, which includes gloves, gown, masks, and in some cases respirators, as and when necessary, in order to minimize the introduction of pathogens. And make sure that the appropriate donning and doffing techniques are followed for the personal protective equipments. Next is patient placement. In reverse barrier nursing, the immunocompromised patients are placed in a positive pressure isolation room. In positive pressure isolation rooms, the airborne pathogens are prevented from entering in and contaminating the air inside the room. In simple terms, the air pressure inside the room is more than that of the outside areas. The next component is environmental cleaning. Appropriate cleaning and disinfection practices using appropriate disinfectants are properly followed in order to prevent the entry of pathogens into the patient's environment. Next is traffic control. Limited access is provided to those who are entering the patient's room, and only essential personnel like healthcare workers or others who meet specific health criteria are allowed to enter inside the room. Visitors should be strictly screened for signs of any illness or recent exposure to any contagious diseases. The next component is use of separate equipments. Equipments are used separately for each patient in order to prevent cross-contamination. So here you go with barrier nursing and reverse barrier nursing. So far we have discussed what is barrier nursing, what is reverse barrier nursing, and what are the key components of both barrier nursing and reverse barrier nursing. If you find this video useful, please like it, share it, and subscribe it, and do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day.